Are all heart attacks the same? Well, firstly, what you call a heart attack and what I call a heart attack might be completely different things. A heart attack is when the blood flow is cut off to the heart muscle long enough such that the heart muscle actually dies. And that is what we call a heart attack. And yes, these can be lethal. 1 in 10 people don't make it to hospital and don't survive their first heart attack. So, a heart attack, what makes it more severe or less severe? This is an important question. You can have a minor heart attack, one that very, very subtle damage is done to the heart. It all depends on where the blockage occurs in the arteries. So think of the blood supply to the heart muscle kind of like a tree. Now, if you block the blood supply off at the trunk, big trouble, right? Even if you block it off to, say, 1 or 2 of the main arteries, also big problem. If you're only getting a blockage happening at the very periphery of the blood circulation, then only a very small amount of the heart tissue is affected. Not so big a problem in the sense that, yes, it might cause you a bit of pain or discomfort, but it won't actually kill you. Now, the important thing is not to ignore it, but to say, okay, here's a sign that something went wrong. And if it can happen there, it can happen in a more important part of our vascular circulation, that blood supply that is going to the heart muscle. And therefore, the next one could be worse. This is a warning. So take that warning seriously, go get medical attention and have it dealt with properly. So that's heart attacks. That's our version of heart attacks. That's what makes it more severe or less severe. All of them are important, and the key thing is not to ignore them and to get some help so that you don't risk a worse event. See your doctor, see your cardiologist, ask good questions, get help. And if you want to know more about heart attacks in relation to heart failure, please subscribe to my channel. There are lots and lots of videos there for you to get educated on your heart health and help promote you to more optimal health and better outcomes, like not just surviving, but actually thriving in the setting of your heart disease. And if you have questions, please leave them in the comments. And please subscribe to the channel so that more people who actually have heart disease can see this work and get the information that they need to advocate for their own well-being and their own success.